Hello everyone, today we're going to talk about myasthenia gravis and Lambert-Eaton syndrome. First, let's talk about myasthenia gravis. Myasthenia gravis is a type 2 hypersensitivity autoimmune disorder whereby antibodies are formed against the postsynaptic acetylcholine neuromuscular receptors. This leads to cellular dysfunction of the motor end plate. You can see from the picture on the right a decrease in the number of acetylcholine receptors. This will eventually lead to reduced transmission and thus weakening the muscles and worsening the activity. Importantly, it's also associated with thymoma and thymic hyperplasia. The symptoms of myasthenia gravis are as a result of muscle weakness. So weakness of the levator palpebrae superioris leads to ptosis. The extraocular eye muscles leads to diplopia. Also, dangerously respiratory muscle weakness can lead to dyspnea, hypercapnia, and myasthenia crisis. We'll talk about that later. Bulbar muscle weakness can result in dysphagia and difficulty chewing. Also, proximal muscle weakness of the extremities. And a distinction between myasthenia gravis and Lambert-Eaton syndrome is that it worsens with use and the deep tendon reflexes are normal in myasthenia gravis. Myasthenia gravis can be exacerbated by a lot of medications like antibiotics, neuromuscular blocking agents, central nervous system depressants, beta blockers, calcium channel blockers, magnesium sulfate, penicillamine, opioids, and statins. And if you know how these medications work, you notice that most of them impact the muscles or the neuromuscular junction in some form. Physiologic stresses like pregnancy, childbirth, surgery, especially thymectomy, and infection can also exacerbate myasthenia gravis. The diagnosis of myasthenia gravis is mainly done through clinical evaluation. The ice pack test is when you take a baseline measurement of the eyelid, then you apply an ice pack for 2 to 5 minutes and then re-measure the eyelid. This should lead to an improvement of 2 millimeters or more in case of myasthenia gravis. This is because cooling of a paralyzed muscle in myasthenia gravis will lead to improvement of the neuromuscular junction. A more specific test is basically taking the serum antibodies against acetylcholine receptor. CT scan of the chest will show thymoma, as you can see at the yellow arrows. Another test is electromyography, and finally the edrophonium test can be used to assess the improvement of muscle strength. However, this is an old test and it's now not used much. This is an explanation of the ice pack test. Feel free to pause and recap. The treatment of myasthenia gravis is mainly pyridostigmine, which is an acetylcholinesterase inhibitor, thus increasing the quantity of acetylcholine in the synapse. Immunosuppressants like corticosteroids and azathioprine. In severe cases, we can resort to thymectomy. The treatments aim to improve muscle strength and to reduce autoimmune activity. Myasthenia crisis can be precipitated by the conditions that can exacerbate myasthenia gravis that we talked about previously. These include infection, surgery, medications, pregnancy or childbirth. But importantly, tapering of immunosuppressants is an important cause of myasthenia crisis. Myasthenia crisis leads to generalized and oropharyngeal weakness, and it's characterized by respiratory failure, dyspnea, and hypercapnia. To manage, we need to intubate. We can use plasmapheresis or IV immunoglobulins and corticosteroids. Now let's talk about Lambert-Eaton syndrome. Lambert-Eaton syndrome is also an autoimmune condition affecting the neuromuscular junction, but the antibodies are formed against the voltage-gated calcium channels at the presynaptic membrane. This reduces the calcium influx, thus decreasing the release of acetylcholine, causing muscle weakness and fatigue. Very importantly, it's associated with small cell lung carcinoma. Like myasthenia gravis, Lambert-Eaton can cause proximal muscle weakness. However, it can also cause autonomic symptoms like dry mouth, constipation, and impotence, which is not found in myasthenia gravis. Lambert-Eaton also causes diminished or absent deep tendon reflexes. Like myasthenia gravis, it can cause cranial nerve involvement leading to ptosis. However, unlike myasthenia gravis, it improves with repeated use. This is known as post-activation potentiation. To diagnose Lambert-Eaton, we can measure serum antibodies against the presynaptic voltage-gated calcium channels. Electromyographic studies are also used. CT or MRI if the chest is used to check for small cell lung carcinoma. We can also use PET scan. Treatment for Lambert-Eaton syndrome, similar to myasthenia gravis, involve immunotherapy and plasma exchange. However, addressing any underlying malignancy is crucial. Prognosis will depend on underlying conditions and effective treatment of underlying malignancies. This is a table summarizing the main differences between myasthenia gravis and Lambert-Eaton syndrome that we discussed in this slide. Thank you for watching.